The Pulse of Providence with Steph Machado on WPRI.com.
I'm Steph Machado, and thanks for watching Pulse of Providence. Joining me today is the newest member of the Providence School Board, Dr. Elizabeth Goldberg. She's an emergency medicine physician at Rhode Island Hospital and the Miriam, associate professor at Brown University, also a mom of 3 kids, 2 of whom are in the Providence Public Schools. Dr. Goldberg, thank you so much for joining me.
Thank you for having me.
So you, as a doctor, as a school board member, and a parent, I think that you hit all of the topics that everyone is talking about today between the pandemic and healthcare, and then of course going back to school. So I think you're the perfect person to talk about for this conversation. I first wanted to ask, and actually I know the answer, did you send your children back to the Providence schools this year, and why?
I did. So I have a kindergartner who is only just starting school this year, and then also a 3rd grader. And I sent them back because they are young, and we tried virtual learning, and we tried sort of take-home homework assignments in the spring, and it really wasn't working for them. And they missed their teachers, they missed their fellow students, and they wanted to go back.
And so a lot of parents were concerned about the safety of going back in person and decided to opt for virtual. What made you think that it was safe enough for them to be back during the pandemic?
First of all, I want to say I completely support the parents that decided to do virtual learning. I don't think parents should be shamed either way, whether they chose virtual learning for their families or they chose in-person learning. I think it's a very personal decision. I personally think that I feel confident that in reviewing the data and in watching the governor speak over the course of the summer, watching our commissioner and the superintendent, that several safety measures were put in place to make this year successful. And I also know that children that are younger are at a steep learning curve for their development, for social emotional learning, for academic achievement. And so I really felt strongly that my children that are young, and all of our children across the state that are younger, should go back when it is possible, when community transmission of the virus is low.
Got it. And I apologize if you just heard some sound. Some window washers decided to show up in the middle of your answer there, but I think they're gone. And so there's been a lot of concern about the air quality in the schools. You obviously felt that it was good enough that it would be safe for your children. What do you make of the concerns that it's just, being indoors with a lot of people in an old building is not safe? And, we see Warwick saying, we think the other districts are doing it wrong. We've ordered 600 air purifiers. Providence is saying, look, we've bought some things. We're going to make do with what we have. We're going to open windows. We're going to do the fans. We're going to get cross ventilation. Is that enough to have clean air quality?
I hear those concerns, and I myself raised those concerns in the summer. I was able to do a school tour with our school principal in August, and we went through the building, and I made several recommendations and also observations, and I brought that back to the superintendent and even wrote the governor's office. And then I noticed that there was a real shift as we started to talk more about airborne transmission of the virus, so that the virus could stay present in the air for even several hours if an infected person was present. We started to, the scientific community in general, and also myself, started to put a greater emphasis on ventilation in the schools. And look, Providence schools and Rhode Island schools are old. The average age of those buildings are 60 years old. And there's a lot of work to do to bring them up to standards that we would like to see, that families deserve. And I really appreciate that there's now been an emphasis on the ventilation. There was a HVAC engineer that went through the buildings, and the recommendation now is to achieve at least 4 to 6 air changes per hour, which is a metric that we think is safe. in order to dilute the virus. And that's another reason why we say, outdoor classrooms are great if you have an outdoor courtyard, or you can bring school outside, have mask breaks outside. That's really important. So I think there has been a shift over the summer in our thinking about transmission. The CDC has started to recognize that airborne transmission is a really important way that people are getting the virus. And as we shift in our thinking, we also need to shift in our safety measures in the school. So I know that based on our last meeting with the school board this past week, that there is an effort to buy more air purifiers with HEPA filters. That's an important measure, just like opening windows is an important measure to bring in clean air. And I really encourage us to continue doing that, because families deserve to be able to send their kids back to school. And as a working parent myself, I understand how torn you can be about sending your kids back into these environments. You want a safe, healthy environment. You want your kid to learn, and you also want to be able to work and bring home income so you can support your family. So it's a really tough position that students are in, that teachers are in, that school leaders are in. And I think, step by step, we're getting there, but there's still work to be done.
You mentioned, going outside for lunch, recess, mask breaks. Obviously we can have windows open right now, although it is getting a little colder already. But what's going to happen in the winter? Because you can't go outside for lunch. The windows are going to have to be closed. These buildings are going to be more sealed up. How does that change the air quality calculation?
Absolutely. So as I said, you want to dilute any virus that might be present as much as possible. And so some of the solutions we've talked about for the winter are continuing to keep windows open and also running heat. So obviously that creates a less efficient system. You wouldn't want to do that all the time. It's not good for our environment, but in the short term, that is one of the solutions that's been considered. Another thing that we've discussed has been getting machines that create warm air, but also continue air filtration. And I can't really tell you what those are called because I'm not an engineer, but that's a solution that I've heard proposed. And then also making sure we dress our kids warmly enough so they can still go outside and have those mask breaks and have recess all year long. Physical activity is really important. This is a high stress time. We know that interacting with nature helps calm nerves, and that's really important. We want to give our kids the best chance to learn, and our teachers the best chance to stay healthy.
So potentially a very large national grid bill for the Providence schools this winter if they're going to continue keeping the windows open. One thing I've heard a lot from folks is about the children wearing masks all day. One, that they feel it's difficult to wear a mask for that many hours in the day. And then second, kids they're going to touch their mask. They might get germs on it. They're not exactly maybe as hygiene conscious, especially the little ones. What is your take on the sort of safety and efficacy of the children wearing the masks all day?
First, I want to say masks are effective against this virus. We know that when you wear a mask, especially when it's close fitting and it's cloth, 2 layers or more even, we know that it reduces your droplets moving around your face and also moving into the spaces where other people are. So we know it's effective. We also know that there's very few conditions where masks might be contraindicated or not safe to wear. My colleagues and I in the emergency department have obviously been wearing masks, 2 sets of masks and face shields since March. And so we know that it's possible to do this. And my own children attended summer camp this summer and often came home and forgot to take their mask off because they got used to it. So I hope that we can, as adults, model this behavior, that it's normal to wear a mask. It will reduce the community spread of coronavirus, and that it's safe. And there's a lot of misinformation about masks, including that CO2 builds up at a unsafe level, and that children aren't able to tolerate masks. In my experience, from what I've seen, kids are absolutely able to tolerate masks, and it's going to increase the safety of the students around them and also the teachers.
What is a misconception that you've heard about COVID-19 that you just know not to be true as a doctor?
There's a lot of misconceptions. First of all, children are not immune of coronavirus. We know that nationwide. 95% of cases have been in adults, but we are seeing cases among children. In Rhode Island alone, 8% of our cases are in school-aged children, so they're not immune, they can get the virus, and it's important for us to have these layers of defense, including mask wearing, cohorting or creating pods, social distancing where it's possible. And so that's one really important thing to say. The other misconception and the other thing I really want to emphasize is if there are family members that are sick at home, it's really important to continue to keep your child at home. You don't want to send your child to school if there's other people at home that are sick. We believe that family transmission is somewhere on the order of 5 to 15%. So if you're at home with a sick family member, you definitely have a higher risk of becoming infected yourself. And then obviously the misconceptions about masks, that they're not safe to wear for extended periods of time. They are safe.
Yeah, you know that, and surgeons and other doctors, I think, know that more than anything, right? You wear them for hours on end. So far, the numbers in Providence in terms of COVID cases show, as of last night, there were 7 cases of students and teachers, but in 6 different Providence schools. And so, and 2 of them were siblings PCTA had 2 students, but they were siblings. Do the numbers so far, are you optimistic that there hasn't been an outbreak in a school, or is it just way too soon with only a week and a half of school under our belt? Do we need a few more weeks of data before we can say, okay, our precautions are working?
Yeah, so first of all, to just define outbreak, when we think about outbreaks, we think about not only individual kids in classes having testing positive for the virus, but we think of actually kids passing on the virus to their teachers, to other kids in the classroom, and that those cases aren't contained. So what I've heard so far from the Department of Health and from the district is that those cases have been isolated that we're seeing so far, and that they've been able to fully contact trace the cases that we've seen. I think it's important to remember that we have 24,000 students in the Providence Public School, and you have to keep in mind the denominator. I would prefer to see no cases. I think that's not realistic given that we are continuing to have community transmission. I think really until our cases are 0 in the state, which is unlikely until we have a vaccine that's been accepted by most people, I think we're going to continue to see transmission in schools. And what our hope is that we can keep that to isolated cases and not outbreaks. And the governor has been very clear to say that if we do have outbreaks in schools, we would have to reconsider in-person learning.
I'm not sure if 24,000 is the denominator because we haven't tested 24,000. Do you think that right now they're testing students and teachers who are either symptomatic or they believe they've been exposed? They're being prioritized for testing. Do you think that all students and teachers in the K-12 system should be tested?
I think in an ideal world, we should have much more testing than we have. I'm really encouraged that the governor has set up the rapid testing that she has. So right now we have rapid testing centers where pre-K through 12, both private and public school students and teachers can get tested and they'll get a same day result. And that I've heard from other families that have gotten tested that they've been able to make appointments up till 9:30 at night. They've been able to attend those respiratory clinics before work or after work. And so I think that is a robust start. Ideally, we would like to have testing of everybody in the Providence School District, of all the teachers, of all the people that are going to be attending in person. And some schools, particularly universities with larger budgets, have been able to do that. Brown University is also testing all their students, but that may not be feasible right now for this large amount of students. But we should strive for that. Testing is the solution, and it's the way that we're going to contain this virus, because as you rightly pointed out, there's a lot of people that are asymptomatic. Sometimes some estimates are that 50% of people are asymptomatic but actually carry the virus and can transmit the virus.
I want to pivot a little bit to your job at the hospital. I'm curious, what is it like there right now in the emergency room? I know at the beginning of the pandemic, we heard a lot from the fire department that they were going on a lot of COVID-related ambulance runs. We heard that not a lot of people were coming to the ER for non-COVID issues because they were concerned about maybe catching the virus at the hospital. What is the state of affairs now? Is it back to normal?
It's not back to normal, but I think that we've all noticed, all of my colleagues have noticed that in the last 1 to 2 months, we've been starting to see more of our regular visits. In March and April, when there was social distancing, volumes were down across the country by 20 to 40%. We were not exempt of that. We saw far less people coming into our doors, and the people that came tended to have more severe disease and also often let their disease kind of take its course for longer and came in a more severe state. So we were really concerned about that. For instance, stroke activations went down during that time, and we know that people are still out there having strokes. And we also saw an increase in cardiac arrests. And so in general, we're happy to see this trend that people are coming and appropriately seeking care, but we're not back to normal. And there's still certainly a percent of the population that is fearful of coming to the hospital despite all of the protective measures that we've taken to keep people safe when they come.
In terms of the number of COVID patients that are coming in, we know that the number of hospitalizations has dipped over time. Is it manageable right now? Is there a section? Is it sectioned off that this is where the COVID patients go?
So we did have particular COVID units early on in the pandemic when we were seeing a lot of COVID patients during the surge. And now we have isolation rooms where we place patients that we believe are potentially COVID positive, but we don't have sections anymore where there's a whole unit that's COVID positive, just because we aren't seeing that many cases on a daily basis. And so that is no longer recommended.
Do you think the state is prepared for a potential second wave? That was something that was always talked about at the beginning, that the second wave might come in the fall. We need enough PPE, enough ventilators. Do you think that we are prepared if that does happen?
I think we're prepared. I think I've been really impressed with the hospital leadership at Lifespan and also emergency departments across Rhode Island and how they've responded to this pandemic. I think we have the amount of staff that we need, and I think that we've now really refined our COVID procedures. We know much more now than we knew in the beginning of March. We know what the typical COVID symptoms are. For instance, we've learned that loss of sense of smell and taste is a common COVID symptom. And so I think we have better procedures, and we also have better medications to treat patients with COVID. My concern is that flu and other respiratory illnesses increase in the late fall and the winter. And I know that we had a dip in immunizations earlier this year. It's really, really important this year to be immunized because we don't want to overrun our hospitals with respiratory illnesses.
What sort of flu season do you think we're going to have? I've heard some people say, well, we're all wearing masks and people are working from home, so maybe there'll be less of a flu season. What do you think?
So it's hard to predict these things, how many patients we'll be seeing with flu, but I agree with you. I'm optimistic because I do think that people, especially in Rhode Island, are taking this pandemic very seriously. They're wearing masks, they're distancing, they're avoiding large social gatherings. All of those measures will help with any kind of virus that's spread either through contact, where the virus gets into your hand and you touch your face and you then become ill, or even airborne virus transmission. So on the one hand, I think that we might see a flu season where we see less people coming to the hospital, but on the other hand, I also know that people are still hesitant to see their doctor and come to the hospital and maybe even get the flu vaccine. So it's really, really important to get your flu vaccination this year and go as early as possible to do that.
Right, and it is already available for folks that don't know. I actually went last week to CVS. It took about 3 seconds, so it's
wonderful. I'm so happy to hear that.
Yes, it was very easy. I was looking up your bio last night, and I saw that one of the things that you're studying is wearable devices. their effects on health, like the Apple Watch. And I'm not trying to be like an Apple commercial, but their newest watch that they just announced has this pulse oximetry feature. And I remember at the beginning of the pandemic in particular, everyone was trying to get a pulse oximeter so that they could test their blood oxygen levels, and they were sold out everywhere. Do you think the Apple Watch or wearable devices can accurately measure this for folks who want to use it for that purpose?
So I've been doing research with the Apple Watch. I think it has some really great health features, including that it can make people aware of if you have a fall. It can alert caregivers or designated contacts. It can also alert EMS if you're not responding. And we know that it tracks heart rate and step count, which can be helpful in people that have bradycardia or their heart rate goes down. I think this pulse ox feature is a great new addition. I am not aware of any studies that they've published to show how well it's working, but emergency physicians around the country think it's useful to have a pulse oximeter at home if you do have COVID, because sometimes you can have what we call silent hypoxia, where you have a low oxygen level, but you might not know that. And some people develop some dizziness or feel short of breath, but they wait too long to come to the hospital. And so a pulse oximeter, whether it's on the Apple Watch or just traditionally bought at the store, usually for $20, $30, can tell you if your oxygen levels are low and you need to make your way to the emergency department. So I think it's a useful tool for people that have COVID if you can get it. And I'm pretty excited that Apple Watch has added this, and interested to see the data about it.
Yeah, I'm really interested to see your research when you finish doing that. Turning to your role on the school board, you just joined the school board in August. I'm curious why. I looked up your resume last night and it was 31 pages. So you're a pretty busy person and a doctor. So why did you decide to take on this extra responsibility? Particularly, I'm also curious why, because the state took control of Providence schools in the fall, and they took control of the school board and pretty significantly stripped the school board of its power. And some people might say, well, now that it's sort of advisory, maybe I wouldn't want to join. But what made you want to join the school board?
Thank you for that question. I have to say that it all started with my membership with PLE, which is a parent advocacy organization. So in February of 2019, many parents got together and said, we really would like a greater voice in how our children are taught in school, the kind of way that the district and Rhode communicates with students and families. And I was really inspired by this group of mostly women, many women of color, who said that these are our kids, and education is really a golden ticket to a better life, and we need to have a voice in how this works. And then shortly thereafter, the Johns Hopkins report was released, and I've always been a passionate advocate for public education. I've always known that I want to send my kids to public school to have the benefits of learning with people that are different from them and come from diverse backgrounds. And I figured if there's improvement that can be made and I can help with my health and medical background, that I should apply. And it's been a really good experience so far. I think we have some very bright people on the board. Two of my major goals being on the school board are really to increase parent and family voice. And I think we've already seen an uptick in families that have come to give public comment during the school board meetings. And those voices are really important. We can't know really what's going on in your home and how the pandemic and how changes to how we do education are affecting you unless you come and you speak. And so I'm really excited about that. I have a new Facebook page to help share what we're doing on the school board and increase community engagement. And then my other major focus is to bring about more communication and more study on how to improve health and wellness. So for instance, later today, we have a meeting to talk about how we can improve asthma control among school-age children. And that's important because asthma is the leading reason why children are absent from school. And we know that when children are absent, they're not learning and they fall behind and don't have the kind of educational outcomes that we'd like to see. So those are my two big focuses, and I hope I can make a difference. I know that the board is now more in an advisory capacity, but I wouldn't underestimate the voices of the really dedicated people that are on the board, and I think we can still make really positive change here for our school community.
Do you feel the school board can still be relatively independent, not just sort of a rubber stamp on what Rhode wants to do, that, you know, if the members of the board really disagree with a decision that they make, that's going to be taken into account?
Yeah, I mean, so far I've only been on the school board for a couple of weeks, so my tenure has been really short, but I have felt that when I've brought up concerns or challenges that my kids are facing, that I've heard from other parents, I've felt that the school leadership and Rhode have been very responsive to that. And I think if we continue to come up with solutions and they're feasible, then we can make changes. In terms of real power, I think if you are intelligent and thoughtful and continue with the same message, then it's hard to ignore that. And I believe our leaders really want to see the same type of positive change that parents and families want to see, that we just need to improve communication about that.
Got it. Well, I look forward to seeing what you are able to do on the school board moving forward. You're brand new, so I have nothing to grill you on yet about your performance. So we'll do that next year. But thank you so much, Dr. Elizabeth Goldberg, member of the Providence School Board, emergency physician at Lifespan, associate professor at Brown University, and mother of Providence School students. Thank you so much for joining me.
And thank you for having me.
And thank you for watching Pulse of Providence. We'll see you next time.